Let's continue with the high blood pressure issue that a lot of Americans are suffering with. We talked about the normal blood pressure, usually less than 120 over 80, high blood pressure between 120 and 39, and the really super, super high one, very dangerous, is over 140 and over 190 sustained. That is important. That's why it's important to check your pressure as often as you can, usually weekly, once a week, twice a week, according to doctor's orders. If the pressure is high, it should be done at least yearly, and report to your doctor any difference in the blood pressure. If it's extra high, let her know what's going on, so she can treat it accordingly, he or she. Okay, by treating high blood pressure, we said earlier, you can help prevent a stroke, heart attack, heart failure, or even kidney failure. Again, here are some more steps to take care of your high blood pressure. Lose weight if you're overweight. Eat a heart healthy diet that's low in saturated fat, cholesterol, and salt. Be more active, at least 30 minutes per day. Do not drink alcohol. Take your medications as ordered. Know your blood pressure by checking it daily and writing it down so you can show it to your doctor. And medications are important as ordered. Just take those as ordered. Many people have high blood pressure and don't even know that they have it because, as I said before, high blood pressure has no symptoms usually until it gets really, really bad. So it's important to control it and know your numbers so you can live a healthier life with medications or whatever lifestyle changes that's needed to keep you healthy and strong. So how do you lose weight? If you're overweight, you can lose weight by increasing your physical activity as tolerated, eating low-fat diet, stay off saturated fats and chocolate, lots of sugar, refined sugars, refined flours. You have like donuts, candies, pastries, cakes, ice cream, etc. Those are loaded with saturated fat, loaded with sugar. They can also increase your weight. So try to avoid those as much as possible. And eat a low saturated fat, low cholesterol diet. This will help to avoid heart attack and strokes. Okay, how do you limit salt intake? That's a good question, right? Okay, here we go. Eating a lot of salt, or it's called sodium, adds to the high blood pressure in some people. It holds excess fluid in the body and puts an additional burden or stress on your heart. Your doctor may tell you to cut down on salt in cooking and adding no salt at all to your foods, but use instead herbs and salt substitute. That will help you a lot to maintain your blood pressure. And I said earlier, do not use or drink any alcohol. That makes blood pressure even higher, and it's not even worth that extra stress in your heart. So how do you become more active? An inactive lifestyle is a risk factor in itself for heart disease and stroke. It also tends to add to obesity, which is a risk factor for high blood pressure. So again, lose the weight as much as possible. Even losing 5 pounds can make a big difference in the reading your blood pressure. Regular physical activity helps to reduce blood pressure, control weight, and reduce stress. It's best to start slowly and do something you enjoy, like walking, riding your bike, gardening, doing housework, whatever it is. But make sure you talk to your doctor before going to any kind of exercise plan, and she will let you know a good plan for you. And then next question, what should I know about my medications? There are different kinds of medicine your doctor may prescribe for you. But don't be discouraged. If you need to take medication for your blood pressure, do it. It's good for you. It will help you. Sometimes you can take smaller doses after your blood pressure is under control, but you may always need some kind of treatment. And if you do, just take the medication. It's not going to hurt you at all. All right, that's why it's important to check your blood pressure so you can know exactly, well, the pressure's fine. I don't need that much medication. Talk to your doctor. She will adjust it for you as needed. Never stop treatment on your own. Some people that I've known have said, well, you know what? I'm taking my herbs. Forget doctor's medication, and they will not take the medication. And as a result, many of them have had strokes, etc., and have kidney disease and problems. So the recommendation is never stop your medication on your own. Talk with your doctor. Any side effects, talk with her, tell him or her what's going on. If you have a headache or dizziness, whatever it might be, let them know the side effects so they can change the medication or adjust it accordingly. But if you don't tell them, they will not know. Okay? So let's talk about some warning signs of heart attack and stroke. Why is that important? Because I said earlier that high blood pressure that's sustained can cause heart attacks and strokes. So what are the warning signs of a heart attack or stroke? Okay, here we go. Warning signs of a heart attack is that some heart attacks are sudden and intense, but most of them start slowly with mild pain or discomfort. With one of these or more of these symptoms, it might be chest discomfort. Number 2, discomfort in other areas of the upper body, your chest, your shoulder, your neck. Shortness of breath with or without chest discomfort, that could be a sign. Other signs including breaking out in a cold sweat, nausea, or lightheadedness. These are all warning signs of a heart attack. So it does have any of these signs and symptoms, call 911. Get to the hospital immediately if you experience any signs of a heart attack or stroke. Very, very important because every second counts. Warning sign of a stroke. Number 1, sudden weakness or numbness of the face, arm, or leg, especially on one side. Number 2, sudden confusion, trouble speaking or understanding. Number 3, sudden trouble seeing in one or both eyes. Number 4, sudden trouble walking. You have dizziness, loss of balance and coordination. Number 4, sudden severe headache with unknown cause. Again, you need to learn to recognize the signs of a stroke. Time lost is brain lost. Again, call 911. Get to the hospital immediately if you experience any signs and symptoms of a heart attack or stroke. This can save lives tremendously and make you have a better outcome. So it's important, very, very important, to remember that high blood pressure is a silent killer. It doesn't have any symptoms at all, that usually. So it's important to check it regularly, exercise, have a good diet, talk to your physician. If you have medications as ordered, take them as prescribed. Never stop them on your own and say you'll take herbs instead of the medication prescribed. Don't do that. It can cause more harm than good. Again, know the signs and symptoms of a heart attack and stroke. If you have any of these symptoms, just call 911, get to the hospital immediately, and the time lost is brain lost. So be healthy and be strong, and remember that you can do all things to Christ who strengthens you. So be healthy, be strong, and I wish above all things that you may prosper and be in health, even as your soul prospers. 3 John chapter 2, verse 2. God bless you. Have a wonderful, wonderful, wonderful day.